Welcome to Health Chat. I'm your host, Xiaofanf Chen, co-founder and president of the Alan Hu Foundation. My husband and I founded the Alan Hu Foundation after our beloved 15-year-old son Alan passed away due to depression in 2018. The Alan Hu Foundation is working tirelessly to prevent such tragic loss from happening to other families. Our mission is to promote mental health, raise awareness, and remove stigma surrounding psychiatric disorders, and support fundamental research for cures. Mental health has many challenges and affects those suffering and their loved ones. Today, this program will give some background on how you can help yourself and others, what to look for, and the services we have in our community. Joining me today is Dr. Jennifer Penney, Chief Integration Officer of Integrated Behavioral Health at Access Community Health. Welcome, Dr. Penney.
Thank you so much for having me.
Please tell us about your background.
Sure. Yeah, so I am a licensed psychologist. Currently, as you mentioned, my role is Chief Integration Officer at Access Community Health. And Access Community Health is a vital safety net healthcare facility serving the Tri-Valley. Over the last 15 plus years that I've been in the field, my passion has really been around developing access to mental health and physical health care, promoting innovative treatments, and really making an effort to match programming to the needs of our community.
Thank you so much. I really appreciate your rich experiences of helping our community members with mental health challenges. Most people have a clear idea what physical health is, but may not be so about mental health. How would you define mental health, and how is it related to physical health?
Yeah, great question. So mental health is essentially our emotional, psychological, and social well-being. It impacts how we feel, act, and behave. It impacts our decision-making, how we relate to others, and also how we make choices. Mental health is just as important in physical health because they are deeply connected. For example, if someone is struggling with chronic stress, it may begin to affect their sleep, their appetite, their interaction with others, and over time they could develop a physical illness. Likewise, if someone is struggling with a physical illness, it may impact their mood, they may develop anxiety or depression over time, and this might also lead to development of other symptoms as a result of their condition. That's why integrated health is so important, because it matches the physical and the mental health component, so we're addressing the whole person.
This is so true. I can't agree more. And what are some common mental health issues our community is facing?
Yeah, great question. Currently, we're seeing rising levels of depression and anxiety in particular, really as a result of the COVID-19 pandemic. These two particular diagnostic categories have increased pretty dramatically. Many people are also struggling with the results of trauma in their life, which really impacts their resources and their ability to cope with day-to-day stress. And we're also seeing substance abuse and burnout in high levels when it comes to caregivers and frontline workers in particular. In the Tri-Valley and in similar communities where there's a lot of academic pressure, there can be pulls towards perfectionism. This can sometimes mask deeper underlying emotional struggles, so that's something we want to be aware of. And while these challenges are real, they can be common, they're also treatable, and support is available.
That's great news. Yeah, we always encourage people to seek help when needed. And as you know, Alan Hu Foundation's work focuses on youth mental health. So do you know any unique mental health challenges this age group is facing?
Yeah, youth today are really facing a different world than previous generations. with pressures from social media, academic competition, and just general uncertainty about their futures in this fast-changing world. They may face isolation, bullying, and also identity challenges. The pandemic also added another layer of disruption to their development, which may impact their social lives. Unlike adults, youth have more difficulty communicating their needs and their struggles. They may struggle to have the confidence to express what they're going through, and so that's why support and listening to the youth is really important. When it seems like stress or irritability is a little bit more common for a youth, it's important to keep an eye on their sleep and daily activities. If their daily activities are becoming a struggle for them, or you're seeing these symptoms persist over time, it's probably time to look at treatment. That's why the work of the Alan Hugh Foundation and other organizations like your organization are really essential to educating the public so that we can be aware of some of these risk factors.
Thank you so much. Comparing seeking help for physical health, people are generally more reluctant to seek help for mental health. Why do you think it is, and what can our community do to help to remove those obstacles?
Yes, so stigma is really a factor in mental health still. People may feel ashamed, weak, or afraid of being judged by asking for help. We don't treat physical illness in the same way that we treat mental health, with shaming or silence. So we really have a long way to go when it comes to treatment and asking for help for mental health needs. Culturally, some communities may also view mental health as a taboo topic or feel that someone is weak for reaching out for care. As a community, we can help break down the stigma by talking about mental health, by openly discussing it with our friends, family, whether it's in a work setting, a social setting, or even faith-based communities, to really get the word out that this is common. It happens to the majority of people at one time in their life, and it's important to keep talking about.
Yeah, so talking about it, keep it in our daily conversation is one of the ways to help remove those obstacles.
Right, yes.
Can you also talk a little bit about integrated behavioral health? Actually, you touched base about that. Would you talk a little bit more about it?
Sure, yeah. So integrated behavioral health is one unique type of mental health treatment. And the idea is that it is really located in primary care. So when somebody goes to see their doctor for a regular medical checkup, they might get a screening asking them about depression, anxiety, maybe their substance abuse. And someone will be readily available to enter the exam room to interview the patient, to tell them a little bit about their options and next steps for treatment. So the great thing about integrated behavioral health is that we're able to address the problem immediately, right in a space that the patient already feels comfortable, and we're able to invite them to treatment when they might have otherwise not ever thought about it.
I think this is the way it should be. It should be at every clinic.
I agree.
Every
Yes.
place.
Yes.
And when you go for a checkup, it's not just physical checkup.
Right.
It's mental health checkup as
Yes, absolutely.
well.
Yeah.
I'm so glad Access is doing it.
Yes, me too.
And thank you for this great information. We're going to take a short break. Stay with us. We'll be back with more of Health Chat in a moment. Welcome back to Health Chat. Today we're talking about mental health. Both the Alan Hu Foundation and Access Bridge strive to help community members to be aware of our own mental health states and seek help when they need. So let's talk about how we support the community. The Alan Hu Foundation Mental Health Lecture Series provides 6 to 8 webinars annually to the public free of charge. Our speakers are eminent researchers from renowned universities and hospitals and brings cutting-edge mental health knowledge to the community. The audience has opportunity to ask questions after the presentation. The foundation also has a scholarship that encourages Tri-Valley High School seniors to studies in mental health related fields. Our annual benefit concert is a beautiful community event that raises mental health awareness and raises funds for our scholarship. Dr. Penney, Access Bridge Mental Health Urgent Care is a gem of mental health program. Would you please introduce it to our viewers?
Sure, yes. So the Bridge Urgent Care Mental Health provided by Access is a free service for all community members within the Tri-Valley. We serve ages 5 and up, and anyone can call that is presenting with an urgent mental health need per their own report. And family members can also call, or anyone that's really having difficulty navigating the mental health system, we're available.
Nice. What can we expect when we reach out to Access Bridge?
Sure, yeah. So a care coordinator is going to be answering the phone. We try to answer all calls during open business hours. And they'll ask some questions about what's going on, whether there are any referrals that are needed. And then within the next day to a week, the community member will have access to a therapist that will complete a full assessment and determine level of need, what our treatment goals might be, how to stabilize the person in the moment. And then we're always working to identify long-term treatment resources, whether it's therapy or psychiatry. And our program also has a psychiatry component, so if someone has an urgent medication need, we can address that also.
This is excellent. I think that's exactly what we need in the community.
I agree.
What is the significant impact Access Bridge has on the community?
Yeah, so just before the pandemic was a peak time for what we call 5150s. So it's usually a psychiatric hold for someone that could be a danger to themselves or others. And we were seeing a huge rise in 5150s in the Tri-Valley. That's really at the point that we decided to create the Access Bridge program. And we've seen a large decrease year over year in 5150s within the Tri-Valley since our program has started. In addition, for the 700 to 800 people on average every year who call into Access Bridge Urgent Care, they're presenting with an urgent mental health need. But by the time that they seek our services, less than 1% of them need to be placed on a 5150 or hospitalized. And that really indicates the level of work we're doing to stabilize patients, engage them in their crisis, and really de-escalate the situation so that there isn't a need for a higher level of care.
This is really impressive. I'm so glad this is an option here.
Me too.
How is Access Bridge Mental Health Urgent Care similar to and different from physical urgent care?
Yeah, so mental health urgent care is a lot quicker to access. So when you call on the phone, someone will be immediately available. You won't have to wait for hours like you might at the emergency room. And you'll actually be able to seek treatment multiple times. So it's not just a one-time show up as that might be for physical urgent care. Typically, the individuals that come to us receive 5 sessions, and we're linking them with longer-term care. So they don't leave without a discharge plan or next steps about what to do for their mental health.
That's great. Mm-hmm. Besides Access Bridge, what other mental health resources can you share with our community?
Yeah, there's some really great resources within the community. As far as education or having questions about mental health and whether someone you love may be struggling with a mental health issue, there's organizations such as NAMI, the National Alliance for Mental Health. There's also the Alan Heal Foundation and Z Cares, which are some local communities organizations that provide education. And then as far as accessing treatment, I really recommend that folks start with their own insurance company because they're able to provide a list of providers that are covered by insurance.
Yeah, sometimes it's difficult to find a therapist or a psychiatrist.
Yeah.
But starting from insurance, and that's a good starting point. Now, of course, then access urgent care, and that's one of the great options too.
Yes.
Yeah.
Yeah.
I want to go back to the starting, the creation of the Access Bridge.
Mm-hmm.
Can you tell us the story behind it?
Sure, yes. Yeah, so as the kind of co-creator and architect of the program, I was really looking to meet some community needs. I had recently heard about some events in the Tri-Valley where someone with a mental health disorder had been killed, actually. And the parents had tried to access so many different resources, and they were unsuccessful in getting treatment. So that really kind of sparked my interest in feeling like we could do something better. We had to go around some barriers to figure out how to develop a program that didn't involve insurance companies necessarily, so that anyone could access the program. And that's what we were able to do, to create something that the whole community can benefit from.
That's great. I hope that instance will never happen again.
I hope so too.
Yeah, it's just a beautiful story behind it. And Alan Hu Foundation is a 501c3 nonprofit organization, and we rely on donations from our community for support. How about Access Bridge? How can our community help Access Bridge continue the program?
Yeah, so given the unique design of Access Bridge, because we aren't contracting with every single insurance company, we do rely on community support to some degree, and we don't have a one funder for our program. So we're really interested in the community elevating the voices of those with mental health needs in the community, and really advocating to keep our doors open and support the local mental health need.
I'm sure we'll work together to keep this program going. Yes. It's just too important to get the support.
Yes.
Okay. Thank you, Dr. Penney, for joining me today.
Thank you so much.
For more information on mental health, go to alanhufoundation.org and accesshealth.org. I'm Xiaofanf Chen. Thank you for watching this episode of Health Chat.